Today's class, we will see clearly about the home visit in community health nursing. Home visit is an important aspect. We are delivering the services in the home healthcare setting. The first thing you have to introduce yourself. How you will be introducing. So you will find out the fact. First you have to knock the door, introduce yourself, then explain the purpose of visit and build the rapport, talk with them clearly, explain the verbal and understand their non-verbal communication and intervene them what is their problems and export and you can plan what they really need, what they known to unknown. And then afterwards while talking you will understand what kind of a cooking demo you want to give, what is their educational plan, what is their knowledge, where they are lacking. You can, it is an giving opportunity to find out what are all the facts and what is you can plan, and you can create awareness about the program. You can do the home visit plan along with the ANM, GNM. So there are different types of home visit: illness home visit, and dying patients you will do home visit, postnatal mother there will be and hospitals once they discharge and you will be getting the hospitalizations. So follow up visits will be done. Mainly you can find, then you can understand mainly their culture. It is an opportunity for you to see the home health environment, because the environment will be causing environment as a physical environment, right, and psychological and social environment, how they are living, physical air, water, what is the pollution or the mosquitoes are there, what is the future they may develop, and according to that you can arrange and organize the this one, organize a health education program. You can do the cooking demonstrations and you can create an awareness, cheap and economically cheap available vegetables, gooseberry, amla, very cheap. You cannot, they cannot afford apple but they can buy amla, and give the health education in a simple manner according to the environmental sanitation. You can assess and diagnose and start the health education. After that, finishing everything after the procedure, cooking demonstration, everything you are doing, and you can because the all is community based, this one home visit only. Once you do the home visit in the community setup, you can reduce the healthcare cost, the economy will be reduced. And that is why home based, that means community based psychiatry, community based pediatric, community based mental health nursing. So once they create awareness, they take care of themselves. So that only we create the awareness. If they have BP apparatus, you can teach them how to check the BP and you can book the appointment. Now these nurses, she is booking the appointment. Now we can see how to write the home visit plan. As I explained you, it is defined as the delivering of specialized nursing care services in the home healthcare setting itself. There are different kind of the home health services available. Illness home health services during the dying patients. They will be in the different stages of dying. So palliative care, no, they no need hospitalization. So just they will visit the home, and the assessment of home visit, just assessment of home visit, assessment of the home visit will be helpful during the survey. 10-year once the government is doing survey, they will assess. Also hospitalization and follow up, long time hospitalization, the patient will be discharged. Follow up care, people will be visiting. What are all the steps? If you see the steps, first you can see as better is a planning for home visit. How you will plan? If you taken a survey, you will be clearly knowing the area of the home, where is that one. First you have to write. After survey you will understand, you have an you have an opportunity to find out what is the fact and what are all the data you will be collected, what is their lack of knowledge, everything you will be knowing that. So according to that you have to write the objectives considering the factors of their the culture, attitude and their medical practice, spiritual practice. You have to consider and you have to plan the home visit. Then approaches to the family member, how you want to make them to understand. So you have to locate the right house, you have to knock and introduce yourself, establish the rapport as I told you. Then you can plan, activities can be planned. What are all the activities? Either the cooking demonstration or the procedure or health awareness, anything, health talk, anything can be planned. Then you have to, next you have to give the calendar and you plan for the next visit, when you will come. Tomorrow what are you going to do? You can tell them and explain them, and then you can close the records of the home visit. Main thing is a fact finding, data finding, and plan for action and follow up and evaluation. So, what are all the principles you have to follow in the home visit? Principle is the visits are made on the basis of the needs and be sensitive to the patient's feelings. Discuss the specific subjects in a sound manner. Scientifically you have to speak in a sound manner. Then use the safe skills because they are going to follow you. You are demonstrating the baby care, baby bath. They will imitate you. So you have to use the safe technical skill. Then have a full understanding about the purpose and objectives of the home visit. Rather, they may tell something, they may divert you. You have to understand your purpose and the collects the facts. What are all the facts about the environment, about the patients, and work with the family? Participatory care, you have to involve in the care. Rather giving the brushing their teeth, you can make the child to motivate the child how to hold the brush, how to wet the brush, how to brush the teeth. You tell them, you involve the family member, you mobilize the article from their home. So these are all the principle. And be aware of community resources and use the resources very wisely. Evaluate your own work and record it. So that is very important. And okay, everything you are planning. What is called planning formula of the home visit? So the planning formula, how you have to plan. For example, when I am entering into the house, 9-month baby Varsha is there. Mother is telling, today my baby was crying continuously and she is not is eating or taking a breastfeed and no social smile. Mother is complaining. So you can understand that why the baby is inactive and so dull, refuse to take the feed. Maybe you have to write the problem. So first you have to assess. These symptoms and all may be acute respiratory tract infection, ERI. So how you have to write in the home visit plan? You have to start. First you have to start with the cough. The child is having a cough or fever or anything. Any one only you have to write. Either the fever or the cough, which is the preliminary one, which is highly you have to think about it, right? Then need should be written. The baby's need is a 11-month baby. The baby need is different. Cough intervention is different. Cough intervention should come in the short term goal. Need will be the long term goal. It is a promotive care. It is a preventive curative care. Kaba, corrective action. This is a preventive action. Kappa, CAPA, kappa. You have to remember that. So the cough, what you will do first, if it is a 10-month baby, remembering that you have to remember the need. So before your visit, before your care plan complete, you have to educate the mother about the immunization, breastfeeding, maintaining the growth chart, maintaining the child safety, maintaining, you can give them the formula, Gomas formula, how you have to do. Now the current problem is a cough. So cough, what and all you can do. So you have to ask them what usually you will be doing. Then they will be telling, we will put camphor oil. Camphor oil, nothing but camphor with, boil the camphor and maybe they will with coconut oil they may apply in the chest, or sometimes they may administer the tulasi extract. So you can honey with honey or some pinch of pepper with honey, advise them. Then ask them, do any prescription is the cough syrup is there, you can give. And then clean the nose with the normal water, clean, wipe the baby's hair, this one, and make the clean environment, and you see whether cough is reduced or not. Otherwise you have to refer the baby. Long term goal, according to this need you have to give the long term goals. What is that? You have to advise the mother about the continuation of the breastfeeding, advise the mother to drink hot water, advise the mother to about the weaning food, small and frequent feeding, and growth chart, how you have to maintain. If the growth is not improving, and cover the electrical plug points, because child will be growing, crawling, sometimes will be walking and putting the finger into the electrical points. So cover the drainage water like that. So accordingly you have to plan for the pre-teaching, post-teaching. So what is pre-teaching? You have to remember in the teaching plan when you are planning, the end result of the health education or any teaching you are giving, there should be a behavioral modification of the mother. What is the change has to come? KAS, you have to remember, knowledge and attitude skill. In Varsha, the mother is having a poor knowledge regarding breastfeeding. So after my health education, what you will What is the knowledge? How you will find out the post-test is effective? Mother is answering all the questions of breastfeeding. She demonstrated the correct technique of this one, and she gained the knowledge. Knowledge she gained about the breastfeeding is the knowledge. Attitude is mother is having a poor attitude towards the allopathy treatment. So now mother is accepted and changed her attitude, willing to take the child to the hospital. I found this one. If at all, attitude you can write it. Mother is having a positive attitude towards maybe breastfeeding skill or anything you can write. But when we found out, she stick on with the home remedy, so her attitude is taking. Anything you can write here according to the skill. Mother have a poor skill in the breastfeeding technique and weaning or food preparation. Anything you can write, any one. So weaning, mother is having a poor skill. You can prepare one weaning food, either whatever the rich vitamin rich or jaggery or iron rich food you can, or ghee. Carrot is very cheap available, so you can make them develop the skill for this one. This is an example for the 9-month baby. And we will see there is a home visit. There is a 45-year-old lady, and she is verbalizing that she has a knee pain. So what is the problem? Knee pain. Knee pain ka problem, you will write the short term goal is her knee pain intervention, but in the long term goal is based on the need of the woman. So 45 year, what is the need? She has to eat the balanced diet, and she has to go for training for diabetes mellitus and hypertension, and she has to, if a woman she is, so she has to go for the self breast examination and screening for uterus cancer and lifestyle education, modification of the lifestyle, because to prevent the lifestyle diseases. Short term goal is a knee pain. So what you have to do to reduce the knee pain, you have to give the hot water application, or you have to fry the salt or the sand. We put it in the one cotton cloth. Motivate her to apply. If there is oil, you can massage and show how much the pressure you have to give. And if there is a grape bandage is there, you have to teach her how to apply the grape bandage too. Or stretching exercises you have to teach. It is more improve the circulation, and last you can give her some calcium supplement and ask her to mother to elevate the leg and sleep. That will improve the venous return. If at all, lastly you have to tell them if there is a severe pain as per doctor's prescription, you can take the painkiller, but it is not continuously to be taken. All these remedial measures you have to do. But long term goal, what is her age? 45. 45 year more prone for getting diabetics and other things. So this is the main advice. Also you have to plan for your major health education. Prevention of sugar, prevention of carbohydrate or salt restricted diet, regular exercises, range of motion exercises. What is the importance of going and visiting the doctor 6 months once and repeating this one, and menopausal education you can give, and iron and folic acid tablet and supplementation. What all the diet which is containing iron rich, that is the one. Then pre-teaching, post-teaching, while interacting you will know what is her KS. What is KS? Knowledge, attitude and skill. The mother have poor knowledge regarding the home remedy of the knee pain, so you will be improving her knowledge. So what is the post-test? Mother has gained the knowledge about this. What is the attitude? Mother has a negative attitude to the primary healthcare center. No, if I go to primary healthcare center, what they will do, like that. So after explaining, no, if you go, they are doing the all these screening test is a free of cost. 1 month tablet they are giving. Then the mother develop the willing to visit the primary healthcare center for the calcium and other tablets. And the skill, mother has a poor skill in exercising technique, so you can demonstrate the range of motion exercise. So this is how you have to write the home visit plan. This is for, we have seen for the baby, we have seen the woman. Now you can see the adolescent girl. What is her name? It's a 12-year adolescent girl. Vanita is looking very dull and feel very sleepy. Mother is complaining that she is always lazy. These are all the symptoms of anemia. I cannot write anemia. Anemia is the medical diagnosis. So what is the problem? Problem is different. Medical diagnosis is different. Problem only you have to tiredness and fatigue. What is the age? Tiredness, fatigue intervention you have to write as a short-term goal. But what is the need? Need for the adolescent girl. So she has to screen for anemia and deworm every 6 months. Creating sexual awareness, because of sexual harassment is very common in India. So importance for the iron-rich diet, menstrual hygiene, because he is in the age of menarche. So good touch, bad touch also you can teach them. Yes, now we will come to the point. That's a tiredness and fatigue. So what is your immediate remedial measures you have to do? If it is you have a home, you have a hemoglobinometer, you can check her level of anemia. And you can make the do the nutritional assessment. You know what is the nutritional assessment? Make sure nutritional ball if you can, and advise her to take green leafy vegetables and give her more water. Like ask her to avoid the junk food and advise her to consume iron supplement as per the government is giving. So here we will plan for long-term sex education, sexual, all these things, iron supplement you will give. What is the pre-test? So the Vanita have a poor knowledge regarding anemia. She has no idea about anemia. She is always telling that there is no relation between the excessive bleeding also due to anemia. So you have to tell your excessive menstrual bleeding may be due to anemia. You have to correct it. If at all she has attained menarche, age of menarche. So Vanita understood about anemia and causes regarding the anemia. Now you see attitude. Attitude is a Vanita has a poor attitude towards the sex education and menstrual hygiene. Maybe she is a very poor attitude. Why I have to buy napkin? I will use the cloth. I will wash the cloth and use. Maybe. So Vanita has. So then Vanita is a positive attitude. How you can see? You can see her. Vanita has clarified her doubts. She has asked many doubts about menstrual hygiene. That shows that her attitude has been changed. What is the skill? Vanita has a poor skill in making a nutrition ball. So you can teach her how to make a nutritious ball with a jaggery, which is iron rich content. So we have seen about baby and 45-year woman and the adolescent. What is the old age? Here we can see the home visit for the 65 Ganesh have a severe pain in the left shoulder and double vision and headache. So when you have double vision and shoulder pain and this one, the primary complaint is the headache is this one. I cannot write anything, though this is the signs and symptoms of hypertension or cardio cerebrovascular accident. It will be enter if you are not treating. So what is the age? Will be 65 year. What does he need? Long term need. Headache has to be immediate remedy you have to give him. In this 65 year already he might have undergone screening. Maybe he forgot to take medication. So according to that you have to check the baby immediately. Give him a space to sit. Check the tablet whether he take and inquire what all they taken or not. If not, immediately give the tablet which is prescribed for his BP. Advise to elevate his leg and sleep, and advise to take deep breath exercise. Immediately follow up with the doctor. Immediately or the next day. Long term goal, what he need in this age? He need a balanced diet, and he need to further screening for diabetes and this one. If at all screening done, every 6 month one should stick on to change of the medications. So should not stick on to the old medication. You have to go. How to go? You have to go to the doctor and after consultation you can change. Long term goal, salt, sugar restricted diet, regular exercise or walking will be the best health checkup. Advice to calcium, take calcium and multivitamin tablet. What is the pre-teaching you will give? Mr. Ganesh have a poor knowledge regarding a lifestyle diseases. Either the hypertension, or else you can write Ganesh have a poor knowledge about complication of hypertension. Okay, then after your post teaching, he gained a lot of knowledge about the hypertension. He cleared the doubts about all these things, whatever he did. And attitude, Ganesh has a poor attitude towards the regular health checkup and screening. Here Ganesh accepted to go to the doctor for every 3 months. Then skill, Ganesh have a poor skill to check his glucometer at his home, or his own BP apparatus doesn't know how to use it, because every house nowadays they have BP apparatus automatic, and also they have a glucometer. You can improve their skill, how to discard it, what is the biomedical waste management, how to prevent the infections from this, you can tell them skill. So the Ganesh has developed the skill in self-checking of taking care of by whatever this BP or the glucometer with this one. So this is how you have to write the home visit plan for the different age group. I have given you here with the baby and the adult like a woman, 45-year woman and would be adolescent girls and the old age. Most of the categories has been covered. You have to remember it. Problem will be focused by the short term goal. Need will be focused by the long term goal. The need will be promotive and action and preventive action. This kappa. This is a corrective action. CAPA, kappa. This is a corrective action. This is a preventive action in community. If corrective and preventive action in the community, healthcare cost will be reducing. So all the community health nurse must take into your mind. Home visit is a very important, and you have to know the steps and the purposes of home visit. So the home visit is giving you an opportunity to support and give empathy, and it is giving an opportunity to give health education in a home setup. You can demonstration, it's giving opportunity, and community health programs can be completed through by mop-up program to identify the needs. It give an opportunity to look into the what are all the problems in the home settings, and it will be helpful for to connect with the other people. It is a coordinated activity. So if there is a poor house, if it is a counselor or the nurse can take an initiation, and then it is an opportunity to bridge the governmental program and take into the home setup. You have a Ujjwala scheme, you have other scheme. These are all the purposes. Though you can, so they will create the awareness. They will be highly motivated. So motivation will create awareness. Awareness will create the interest. Interest, they will participate with you. Participate, they will involve with you. Last will be achievement. Achievement, there will be a great behavioral changes will be there, and they will accept, and there will be a usefulness for our home visit. So this is the purpose, steps, assessing, and how to write the home visit plan in a community setup. Thank you.